Bankart injuries commonly result from anterior shoulder dislocations. Often occur during contact sports or high-impact activities. Falls on an outstretched arm or sudden shoulder forces can cause damage. Recurrent dislocations weaken the labrum, requiring surgical repair. Optima Duwloc Anchor. Available in 2.8 mm and 3.5 mm. Soft tissue repair is secured using the knotless Optima Duwloc Anchor. Sutures are tensioned easily before anchor insertion. Precise tension is achieved while knot-related impingement is minimized. Position the patient in the beach chair position for shoulder access. Use a tissue elevator to free the tissue and control the labrum. Insert a reusable suture passer into the shoulder joint space. Position the reusable suture passer beneath the torn labrum. Pass the nitinol wire through the reusable suture passer. Use a suture retriever through another portal to pull the nitinol wire out. Load the suture onto the wire, then retrieve the wire and reusable suture passer. Retrieve the second end of the suture so both ends exit through one portal, forming a loop around the labrum. Insert the 190 mm 8-point slotted drill guide into the joint and position it on the glenoid rim. Use a 2.5 mm drill bit through the guide and stop when the stopper contacts the drill guide. Remove both the drill bit and the drill guide. Load both suture ends into the 2.8 mm Duwloc Anchor using suture passer. Position the Duwloc Anchor into the joint space and align the eyelet with the drilled hole. Pull the suture to reposition the labrum anatomically. Release the suture slightly to allow proper anchor and screw positioning. Tie the suture securely around the anchor handle. Use a mallet to seat the 2.8 mm Duwloc Anchor until the first marking contacts the bone. Remove the black stopper from the Duwloc handle. Mallet the anchor again until the second mark aligns with the bone. Remove the handle by rotating it anti-clockwise. Cut off excess suture. Repeat this procedure for each anchor to restore the labrum fully. This completes the shoulder instability surgery using Auxein's Duwloc Anchor. The shoulder is immobilized in a sling for initial healing. Gentle passive and assisted motion exercises are started gradually. Strengthening begins once pain-free movement and healing are achieved. Heavy lifting and overhead activities are avoided until full recovery.